Hello, hi, my name is Shania. I attend the College of Charleston and I am currently in African politics. One of the projects we were to do was a political activism project. I chose to work with the Diamonds Organization for Teen Pregnancy Prevention. I've worked on the Melanie Lee, the director in Sumter, South Carolina. I chose to do this program because during my high school years, I noticed that teen pregnancy was becoming a problem. There were a lot more teens within the school that were pregnant themselves, as well as teens that were not even in high school that were becoming pregnant. And I saw more of that when I moved to Charleston, South Carolina, which it almost seemed like it was three times more as likely to see a pregnant teen within Charleston County. The United Way Diamonds Teen Pregnancy Prevention Program was organized in March of 2000 as an initiative of the United Way. It is a comprehensive abstinence-based teen pregnancy prevention and sexuality education program that partners with other agencies such as schools and church. They provide age-appropriate, interactive, science-based curricula to middle school and high school students. Since its inception, Diamonds has served more than 1,000 students. At Diamonds, they are committed to providing a cutting-edge, scientifically based program, making a difference. Diamonds is an 8 modular middle school curriculum that provides young adolescents with the knowledge, confidence, and skills necessary to reduce the risk of sexually transmitted diseases and for teen pregnancy prevention by abstaining from sex. Within Diamonds is also another program called Wise Guys. This program acknowledges young males as whole individuals with a variety of needs and desires. Wise Guys relates responsibility in teen pregnancy to self-esteem, values, healthy relationship, human sexuality, decision making, and goal setting. This particular project, linking it to African politics, because it is a big issue within the African American community, more because if you look at the statistics, African Americans they have a higher rate of living in poverty. Therefore, if they have teenagers that are giving birth to kids that they cannot afford, then that becomes a problem. Black teens are more likely to become pregnant, 134 per 1,000 women, as in comparison with white, which is 48 per 100. That's almost three times. That is three times more. They're three times more likely to become pregnant than young Hispanic whites. Within my project, I was to collect data on different issues that Miss Melanie had me look up, and one of them was I was to research the Rockdale County syphilis event, in which one male young teen, 16 of age, was able to infect at least 20 students within the school itself and caused an outbreak. Another problem to address is that why in South Carolina in the Bible Belt do you have 793 births per 1,000, and why is this not being addressed? I was also to compare Sumter County versus Charleston County. In Sumter County, each year teen childbearing costs Sumter County taxpayers approximately $5,044,000. That's a lot of money. The cost to the state of South Carolina is $156 million. Charleston County, each year, teen childbearing costs Charleston County taxpayer approximately $10,303,000. That's twice as much money as it costs for Sumter County. And again, the cost to South Carolina is $156 million. Contributing factors that are taken into effect are the lost tax revenue, which includes the lost sales and income tax due to the lost productivity of teen mothers, the fathers of children of teen mothers, and the children themselves. Public assistance, the taxpayer costs associated with all public assistance, including health care, child welfare, TNNF, food stamps, and housing. And the incarceration of sons of teen mothers. The taxpayers' cost for increased incarceration rates among the sons of teen mothers. Teen pregnancy is not a single issue. It affects us all. Taxpayers, the programs that are funding parents of teen mothers, such as housing, food stamps, what I said earlier, the money is coming from somewhere, and it's coming from us as taxpayers. Teen pregnancy prevention is a need for investment. As a community and as a state, we must recommit ourselves to our most valuable resource, our children. This is not a time to eliminate programs for teen pregnancy prevention. It is a time to reinvest in the programs that research has shown to be effective. Investing in prevention comes with a huge savings to South Carolina. $92 million alone in 2004. Results show that with continued dedication and focus, efforts to reduce adolescent pregnancy can be successful. That's my part of my data that I researched and gathered. Now, for my personal opinions, I feel that and I agree with Melanie, director of Diamond, if I feel that once the money has been put there to fund such programs in teaching teen pregnancy prevention awareness and STD prevention, I feel that once you have if you're still having alarming numbers, once you've had money that's already been put aside for that, when you still have teens that are getting pregnant based and they already have the knowledge, so we cannot say that they do not know, because we're teaching this in school, we're making this a curriculum that's being taught in schools at an earlier age appropriate, where they can understand it. I feel that money that the government is giving, it should be taken out of programs such as those. You have full-time college students, as myself, that cannot receive EBT, such things as EBT benefits, to help afford groceries, transportation, and housing. What college student would not want someone helping with that housing? Because you have money that is being set aside for people that just are ignorant, and they don't care. Either they're ignorant or they don't care. We've shown them the information, and they still go out there and have sex unprotected, still get pregnant, and yet we're giving money to them. In order to receive assistance for such things, with me being full time, I would have to work at least 20 hours a week. So you mean to tell me that there's some pregnant teen mother out there who just, regardless of the fact that they wanted to use a condom, I'm pretty sure they had a condom available at the Sumter Health Department. They give away free condoms. Give away free condoms. And you mean to tell me that because they didn't want to use a condom, they get to get assistance and I can't get assistance? I have to work 20 hours while I'm in school in order to get assistance? That is ridiculous. I will leave you with the pamphlet that I received. It's called the How at Risk Are You pamphlet. I call it the STD multiplication timetable. As you have noticed that on one side is the number of sexual partners that you've had, and on the other side is the number of partners that you've actually been exposed to. So, for example, if you slept with, and this only works if every person that you slept with has the same number of partners as you. Ideally and realistically, no, that is not the case. But anyway, say if you slept with 3 individuals, well, you've actually slept with 7 people, because that's how many people you've been exposed to. If you slept with 8, you've slept with 255, and if you slept with 10, then you slept with over 1,000 people. Maybe you didn't sleep in the same bed with them, but you slept with them regardless of the fact. Well, at the bottom of the pamphlet, there's a quote by C. Everett Koop, MD, former U.S. Surgeon General. It says that when you have sex with someone. When you have sex with someone, you are having sex with everyone they have had sex with for the last 10 years. And everyone they and their partners have had sex with for the last 10 years. That is ridiculous. I will leave you with this. Teen pregnancy is 100% preventable. What do you plan to do about it? Thank you.